Educational psychologists. What do they do? Educational psychologists tackle the problems of young people who may have learning difficulties and social or emotional problems. They carry out a wide range of tasks to try and enhance children's learning, and also to enable teachers be more aware of social factors affecting teaching and learning. They write reports on children for learning difficulties such as ADHD, autism and others, and also recommendations on the allocation of special educational places or special needs assistance, and sometimes as part of court proceedings. Where do they work? Most educational psychologists in Ireland are employed by the National Educational Psychology Service, NEPS, and they work in schools, colleges, and some in private practice. How do they work? The work of an educational psychologist can either be direct with a child or indirect with parents, teachers, and other professionals. Direct work involves some form of assessment to investigate a child's problem. Investigation would normally be through the use of test materials, observation, and possibly interview. The result might be to devise learning programs and/or collaborative work with a teacher. Recommendations are then made to determine the most appropriate educational provision for that child. Indirect work with parents requires consultation and careful discussion, as the psychologist's contribution needs to be understood by people who may know little about psychology and, of course, are emotionally involved with the child. Beyond their main work and as state employees, educational psychologists are often called upon to advise or join working groups concerned with education policy planning. In addition, with their research background, they are in an ideal and often unique position within the Education Authority to plan and carry out research activities. That is the role of the educational psychologist. Health psychologists. What do they do? Health psychology is a relatively new field of applied psychology. The aim is to promote changes in people's attitudes, behaviour and thinking about health and illness. The area is far-reaching, including the use of psychological theories and interventions to prevent damaging behaviours such as smoking, drug abuse and poor diet. Also, to change health-related behaviour in community and workplace settings. To promote and protect health by encouraging behaviours such as exercise, healthy dietary choice, teeth brushing, health checks and self-examination. Another area is health-related cognitions, investigating the processes which can explain, predict and change health and illness behaviours. Health psychologists also look at helping people working in healthcare, researching the nature and effects of communication between healthcare professionals and patients, to improve that communication and prepare for stressful medical procedures, etc. In terms of patients, health psychologists look at the psychological impact of acute and chronic illness on individuals, families and their carers. And psychological interventions may be used to help improve quality of life and or to reduce the limitations of disability and handicap. Where do they work? They are often employed by academic institutions and would lecture also. Some work in clinical practice or hospitals, promoting self-care behaviours among patients. They may also work in other areas, including the health service executive, in research posts, or with voluntary agencies. Health psychology.